Where are you in Dubai in terms of your telehealth initiatives?
Well, I'm working in the regulation, and we have been regulating different telehealth bodies that are taking place in the private sector. But what's new to us is implementing the telehealth service in the governmental. This is quite new for us. A project called Dubai Doctor for Every Citizen, which is a direct translation for the vision of His Highness Sheikh Mohammed bin Rashid Al Maktoum. So this is where the focus of telehealth is taking place at the moment in Dubai Health Authority.
This is a big challenge.
Yes, it is, yes.
Doctor for Every Citizen, you're talking about completely universal coverage, and clearly in a primary care scenario, we're talking about significant supply-demand challenges already, aren't we?
Yes, we are. The implementation is quite novel for our patients, and a lot of them are finding it very difficult to engage in something that is very new to us. But at the same time, with this, despite all the challenges, there are a lot of opportunities here for our patients to have the service on hand.
Yeah. It's not new to you, new to all of us. Yeah. we're all finding our way.
Yes.
Because you've also done some very interesting and I think innovative thinking in this respect in terms of these clinicians you've used to start with.
Yes.
You've used clinicians, I think, that are known to the patient to get over these difficulties. Could you describe that a little?
Yes. The process that we're using in Doctor for Every Citizen is a consultation or a virtual consultation based technology, and we had recruited doctors from Dubai Health Authority, and we trained them with a company to teach them how to use the service and what guidelines they should be using and how they could tackle patients without obviously examining those patients. Now, one of the challenges that we have been facing in this, that a lot of our patients were quite timid to start using the service. They weren't sure if they'll be dealing actually with the human factor in there, or and who's that person behind the screen that we can't go and have that social interaction with. We have then decided to handpick some of the doctors that have been in DHA for quite some time, 30 years or older, so they're senior doctors, very experienced, have their pool of patients.
White hair.
White hair, definitely. And those doctors are currently running the service for the Doctor for Every Citizen, and patients love it because they actually recognize the doctor. They've seen him in person or her in person, and it makes a huge difference for them.
It makes an enormous difference, because then it's a continuation of a relationship.
Continuation of care, definitely.
Yes, absolutely. Yes. You mentioned something else that's, I think, quite exciting, and you mentioned the fact that you've arranged for special training. People think erroneously that telehealth is basically a consultation which takes place normally, but there's a little medium which changes it, which is the screen.
Yes.
But actually, training-wise, it's very, very challenging for a physician.
Yes, I mean, we are now at the stage to ask ourselves, are we going to adapt telehealth or not? I think we're in the stage to ask how we're going to use the service and how can we implement it in our country. These doctors definitely had the challenge initially because we were used in as medical students back then to examine the patient, to go through the stage of inspection, examination.
Absolutely. All of us are trained like that.
Exactly. Yeah. So if they don't have that, but the question is, are we triaging those patients? Are we just providing a counseling for those patients? But that's not correct. Once you go into the proper training and you're taught to look into red flags, for example, and examine those patients by asking the proper questions in the history. Actually, research has shown that 70% of the consultation relies on a proper history taking of the patient.
But also, we now have a multitude of devices which soon will be introduced, whereby people can actually use some sort of mobile technology to be able to provide an element of examination remotely as well.
Yes, that is correct. We have actually done a little study on Tele Monitoring in our patients in Dubai Health Authority with a private company. Initially, the concept of Tele Monitoring has been like a dream for us to actually implement this to our patients and providing it, with all the charges and the security measures. But we have done this pilot study on our patients, and we have used these monitor devices at home with some alert system to inform the patient, like whenever the sugars are high, for example, or the blood pressure goes down, that there is a doctor on the other end that is able to visualize these and can provide help. So the patients that we have picked are patients with chronic comorbidities, and they are above the age of 75 years. Some even have COPD. conditions, and some are not even mobilizing. So what we did is these doctors would come and visit whenever required, sometimes for suctioning, sometimes for changing catheters, and we have realized that there is a phenomenal reduction in the cost on healthcare. Yes. Those patients did not require readmission for hospital, and not to forget acquiring other infections, and those patients as well felt a great satisfaction feel of knowing that they're always being monitored and always being looked after.
Yes.